What's going on, everyone? Happy Thursday. Hopefully everyone's doing well, staying safe, healthy. If you had to take a COVID test, flu test, maybe a test for RSV or some other virus, I hope you have tested negative. If you did test positive for any of the viruses, I hope you have a full and speedy recovery with no long COVID issues and no long-term issues. It is time now for the Thursday edition of the Virus Update for Thursday, February 20th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there this year, and chances are you or someone you know is sick right now or was sick at some point during this winter, or maybe you got sick and you just did not get better. Sound like something you've heard a lot of? Yeah, it's something that's happening quite a bit. You need to be informed with what's going on with the latest news, data, and everything else in between with these viruses. That's what I do here each day, just to keep you safe and informed. If you want to subscribe to my channel and be informed with what's going on, just hit that subscribe button down below. Help me reach 10,000 followers. Of course, give this video a thumbs up if you like this content. Share this video with anyone you know, and leave your comments down below. And don't forget to hit that notification bell. Let's try for 200 like button hits today. I haven't done that for a few days. Let's see if we can do it today. Alrighty, we do have a ton of things today, as is usually the case on Thursdays, Fridays, sometimes even Saturdays. But we do get a lot of weekly data today, and I do have a few surprises up my sleeves. You may have noticed by today's title. Yeah, that may be a giveaway to a couple of the surprises that are coming in today's update. So let's get right into this, because I think we are definitely going over 20 minutes today. All right, bird flu. I believe that's the first three news stories I have lined up here. In Ohio, counties issue declaration of emergency support amid ongoing bird flu outbreak. Yes, this is not good. This is the Miami Valley of Ohio, not to be confused with Miami, Florida. There's a Miami Valley in Ohio. As the highly pathogenic avian influenza outbreak continues to affect Ohio farmers, two local counties have made a declaration of emergency. And this was on Tuesday, February 18th, that they did this. And those counties are Drake County and Mercer County in Ohio. All right, scrolling down here, we see the ability to perform more testing on bars that have been positive but aren't showing any symptoms, emergency financial support to poultry farmers in the country who have been directly affected by the outbreak, including compensation for the loss of poultry and revenue losses to quarantine and depopulation measures, resources such as personal protective equipment, disinfectants, and biosecurity supplies, support for veterinary professionals and disease control experts, an extension for the existing federal or state agricultural relief programs, and some other things. So, yes, it also says full in cooperation with state and federal agencies. I think we need to see more counties in more states start to do this, especially in counties that have been hit hard, where there are, a lot of outbreaks going on. And this is something that's very important. We really need to take bird flu more seriously. It's a problem that's out there, and it's not stopping anytime soon until we make the effort to try and stop it. All right, moving on next. Mysterious death of 6 Canada geese in Hillsborough sparks fears as bird flu spreads across New Jersey. Yes, we have seen several stories in New Jersey as of lately, and here's the interesting case about this one. This happened directly across the street from the Hillsborough High School. I hope no one was over near the water where this was afterwards, because we just don't know. Can dead geese still be contagious and infectious? If you see a dead bird or dead animal in the woods at this point, please do not attempt to go near it. Call the proper authorities. Maybe it be the Game Commission in your state, a local agency. Call someone who would be responsible and can come out and take care of the situation, and hopefully test to make sure it was or was not bird flu. And again, like I said before, maybe we will start getting some sort of a list going. Maybe I'll start a thread on my site, and anyone can join in. If you know any contact information for a state, add it in there. Moving on to this, Massachusetts now. A zoo mourns the beloved harbor seal who died of avian flu. Yes, this is really sad. Blue. A 21-year-old harbor seal was a resident at the Buttonwood Park Zoo in New Bedford. This is in Massachusetts once again. They did some testing after the death, and it turns out, yes, it is the highly pathogenic avian influenza. So yes, not a good day for H5N1 news. And now going over to regular flu. Flu cases surge in Connecticut as pediatric deaths rise nationwide. So Connecticut, is seeing some of the similar things that are going on in many of the other states. I'm looking here to see if we had cases. I could have sworn that I saw cases here. It says, according to public data from Connecticut Department of Health, flu cases have surged significantly in the state, with the percentage of emergency department visits due to influenza rising from 2.8% at the end of December to 8.5% by February 1st. Hospitalizations have also increased considerably. 424 patients were hospitalized with the flu during the week ending February 8th, up from the previous week's 365 and significantly higher than earlier in the season when only 6 patients were hospitalized by November. Think about that. That's a big increase, and that's not including the fact, some people were admitted, then released, admitted, then released, and that process just kept going, and as the process keeps going, it just kept trending higher and higher and higher, and hopefully Connecticut is getting ready to hit its peak at this time, because this is really bad, and it's been really bad everywhere this year, and in some states, flu this winter was worse than COVID. All right, not New York. We will get to New York later, hopefully. North Carolina Department of Health and Humane Services reported a total of 34 deaths last week, now reaching 246 deaths of flu in North Carolina. 181 of those people are over 65. 43 of those were between 50 and 64 years old. 20 of them were between 25 and 49. 2 of those were between 5 and 17 years old. Yes, even children have died of the flu this year, not just North Carolina, but many different states. In Arizona, hospitals are hit hard by a combination of respiratory viruses. The flu, RSV, COVID, and norovirus have sent thousands of residents to urgent care and hospitals and put a strain on resources. And this gives me a good moment. We got to pause for just a second. I see so many comments on social media, whether it be X, not Blue Sky. Blue Sky is a well-behaved site. I've seen 1 or 2 trolls, not many. Facebook. Facebook, the comment section of these virus reports in Facebook has turned into an absolute trash can. It has. There was a local news story yesterday about a hospital near me called Jean's Hospital. It's in northeast Philadelphia. And really, they were talking about flu in the Philadelphia area altogether. I didn't put that story up there today because we'll get enough of Pennsylvania in just a little bit. But the point I'm trying to make is I'm reading through the comments section. It's like, why do I even bother? It's absolutely ridiculous. Some people are saying, diseases have always been around. This has always happened. Okay, yes, diseases have always been around before COVID. But why must we let things get so bad each year? Why don't we try and maybe, curb the spread of these annual diseases in the wintertime? Maybe, put masks on again in the wintertime. Use clean air. Hey, we could actually maybe make these virus seasons less severe. And yes, I know, COVID can be all year round. But the fact that we're just letting things get worse and worse at a time when we know COVID can damage the immune system, and we know a damaged immune system can lead to more severe cases of other viruses, or also more spread of other viruses because people are picking it up more easily because, hey, any little thing they're coming in contact with, they're getting a cold, they're getting a flu, they're getting this, they're getting that. It's happening. We don't need to let things come to be so bad at this time of year. We can help curb the spread. We won't be able to fully stop the spread because not everyone's ever going to cooperate. But hey, we could make these waves of illness less severe if everyone did their part. All right, moving on. I had to get that off my mind because it's just driving me nuts. And, well, we do have a lot more things to go through. Measles outbreak declared in Lee County. This is in New Mexico, and looks like 2 cases have been reported there. Next door in Texas has had as many as 58 cases, I believe. Now, this is saying 48. Pretty sure that is now up to 58. Did we not report 58 the other day? All right. New South Wales. This is over in Australia. Respiratory surveillance reports week ending February 15th, 2025. This is from Dennis, the COVID info guy. He always posts stuff on X and on Blue Sky now. This is fantastic that he posts this stuff. COVID positivity rate in Australia is 6.1%. That's up slightly by 0.3%. COVID. Overall cases have gone up a little bit. 1,392, that's up by 4.4%. Influenza is down by 0.7%. RSV, 720 cases. That went up. That's up by 22.8%. And mind you, it's going to be fall there pretty soon, so they are going to start maybe trending higher. They already are starting to trend higher a little bit. But good to see flu went down a little bit. Remember, they had that bit of an increase back during the Australian Open in Australia, and I think New South Wales, they might have been part of that as well. Pertussis, whooping cough, it looks like whooping cough notifications have dropped. So the highest rates of pertussis notifications are observed in children ages 5 through 14. New South Wales COVID-19 sequencing looks like XEC is at 62% of the cases, and looks like for the various regions, for the most part, it looks like wastewater is trending down, except for one region at this time. All right, UK weekly update. The only thing we can really look at here, we can't look at COVID today for there. I mean, we can look at it on this chart. You can see there's a little bit of an increase showing up. But when you click on it, and I hope maybe it's different now, yeah, not seeing much of an update. Deaths, 85. I think that's the same number. People admitted to the hospital, up by 7.3%. Again, that's looks like that has not updated since January 31st. Weekly cases, just up by 5 again. I don't know how accurate that is. It's 826 now. If anyone wants to go back and see what last week's numbers were, that would be great. I can go back in my video from last week and see what it was, but it seems like they're following a pattern here where things just go up by 5. RSV, not dropping as much, has slowed off a little bit. Influenza continues to drop there. Moving on, we do have more things to get through. Taking a look at this in Canada, and we can see the viral wastewater level for COVID is moderate. Flu A is high, flu B is moderate, RSV is high at this time. All right, my website, datareport.info. It has tons of information on all these different viruses, mainly links to news stories or various different studies, or even some individualized posts. There's an archive of COVID positive, celebrities who have had COVID positives. Haven't worked on that in a while. I'll get back to working on it again at some point. Datareport.info. In Pinellas County, Florida, we do see here, seen some red here on the right, some ambulances that are being held up at hospitals. That's not a good thing. That means the hospitals are very busy. Look at that. Cardiac arrest call. Not good. We're seeing too many cardiac arrest calls as of lately. I'm not liking the fact that we keep seeing that. On Wednesday in Philadelphia, there were 751 EMS incidents reported. And taking a look at what's going on outside of Philadelphia in Montgomery County right now, and look at that, no cardiac arrest, but not 1, not 2, not 3, not 4, but 5 respiratory emergency calls. Got to keep an eye on to see if that starts increasing, because in that news story I saw yesterday on the news, they did mention if we're going to see anything here in Philadelphia in relation to that Eagles parade last week in our area, it's going to be starting right now. And respiratory calls increasing. That's not a good thing. Does not look like we... Oh, never mind. Here comes Chester County. Wasn't certain if we'd be able to get it. Wow. A lot of ambulance calls in Chester County. And look at this. Not 1, not 2, not 3, not 4. 5 respiratory emergency calls. And I am seeing sick person listed. And a whole bunch of other things. Yeah, respiratory calls are going up. That means illness could potentially be rising. Or post-illness related issues. Flu, COVID. A lot of people are having post-flu issues this year. More than usual. Taking a look at what's going on with the hospitals in Pennsylvania. This is actually not bad. South Central Pennsylvania. It's kind of hidden here, but there's just one hospital, and that's a behavioral health diversion. Lehigh Valley still has some hospitals with problems. Tamaqua, Lehighton, Jim Thorpe. Some problems going on there. 3 hospitals with issues. Southeast Pennsylvania still having some issues. Taking a look at what's going on in New Jersey. Let me refresh this. And we can see here there are definitely some hospitals that are having problems. Look at that. Yet again, Princeton Hospital in New Jersey, Penn Medicine, is on a full emergency department divert. That is not a good thing. Alrighty. Now for one of the surprises. This is actually the second surprise. Me showing you something from Australia was a surprise. Now for one of our surprises again. And that is, we can take a look at what variant is circulating here in Pennsylvania. And get this, LP.8.1 has now become dominant in the state of Pennsylvania. It actually even says it right here. Current dominant variant in wastewater in Pennsylvania is now the LP.8.1 variant. And I believe if I hover over here, yes, it is now at 23.79%. And you're saying, well, that's not a very high number. You're right, it's not, but take a look at all these different colors. And there's actually a scroller. You can't see it. It's underneath my camera here, but there's actually a scroller with a whole other list of variants. And then that goes down again. So there's a lot of different variants in Pennsylvania. But LP 8.1 has now taken over, and I think that's going to shorten the list a little bit, or at least potentially shorten the list a little bit. So with that said, we now need to take a little bit of a look at wastewater if we can. I'm going to try and move myself to the center. I don't know if this is going to do anything or not, because I want you to see these charts. There are definitely some places in Pennsylvania that are starting to rise, and I don't know if that's as a result of what I just mentioned, but it's relatively concerning to see this. Here we go. Take a look at this rise. This is in southeast Pennsylvania. I believe this is the wastewater site in Delaware County. There's several wastewater sites in southeast Pennsylvania that are starting to rise once again. Take a look. Look at this. You can see it's clear. It's multiple updates rising once again. We can also go over to Chester County, and this is a little bit more concerning. This is a big rise. I hope this gets corrected, because that's the biggest rise that we've seen going all the way back to 2023. That would be very concerning. Northwest Pennsylvania. Yep, seeing rises there as well. And let's make that full screen. You can see here, clearly going upward. You go up to northeast Pennsylvania, similar deal. We're starting to see a rise there for COVID at this time. But now, I also got to show you this. Moving myself back to the spot again. I don't know if the camera actually did what it was supposed to do. Take a look at this now. And we can see, actually moving me one more time, we can see influenza, flu A in wastewater in Pennsylvania. Yeah, it's still going up. That's not good whatsoever. So, cases may be doing one thing. Flu A is doing something else of its own. I'm not enthused to see this whatsoever. All right, keeping myself back right-hand corner. All right, taking a look at Walgreens this week for flu, 6.01% positivity rate. And when it comes to COVID at Walgreens, we see the positivity rate is 10.9%. Going over to wastewater scan, taking a look at Colorado, North Parker, Colorado. Just going to do one wastewater site here, so we have a lot more things to get through. We can see COVID at this time is listed at high. RSV is high, and yeah, RSV's rising a bit. Yeah, COVID's rising a bit. Influenza is hopefully this drop will continue. Influenza B is not rising. It's A that's dropping at this time. It's good to see no influenza B. HMPV is low. EVD 6.8 is low. Norovirus is high at this time. Everything else is fine. Very odd how only certain places are rising for influenza B at this time. Some places are, some places are not. All right. Yesterday I got a request saying that could I show what influenza is in Michigan? And I can do that right here. Hey, if you guys ever want to see an area, just ask me in the comments down below. I'll respond as to whether or not I can find anything for it, or I'll say, let me see if I can find anything. And if I can, I'll try and include it in my reports. Or maybe it's an area for wastewater, or whatever the case may be. I'll do my best to try and find data for you. Pretty straightforward here. Unfortunately, Michigan, and take a look at this. Very high at all the wastewater sites, which translates to very high. Not a good thing. Alrighty, now moving over to some data from CJS. And before we get to that, we're going to do two things. First off, I got to remind you, a peak in the viruses does not mean all is safe again. And we're seeing many different places do their own thing. You just saw Pennsylvania. The wastewater was still going up. You see Michigan is still very high. Michigan may have peaked for influenza. But just because an area is peaked does not mean it's safe again. You're still going to get a lot of cases on the backside. I mean, you have to come down from those very high levels. It just doesn't go up and then go, that's it, shut off. No. Remember how things go up and rapidly go up, or steadily go up, or whatever the case may be? Well, then you have to go back down that mountain, because what goes up has to come down, and it takes time to do that. So we're still going to be in a risky period for some time. And the other thing is, I need to remind you to take a hydration break. Maybe you're a person that needs to drink a lot of water. Maybe you're sick right now. Whatever the case may be, you need to drink your water. Let's take a hydration break right now. Alrighty, didn't that feel good? Okay, some data from CJS 83172. We have 2 days worth of data. After that, we have some more states to look at. Then we will call it a day for today's video. Tuesday, New York, daily number, 940 new cases. Puerto Rico, daily number, 207 new cases and 2 new deaths. Maine, weekly number, 268 new cases. This is all for COVID now. And 13 new deaths. So that's 268 cases, 13 new deaths for Maine. Michigan, still doing bad for COVID. 3,083 new cases and 34 new deaths, enough to raise the cumulative state reported death count in Michigan to over 46,000 deaths of COVID so far. Virginia, weekly number, 3,485 new positive tests and 23 deaths reported by the CDC data tracker last Friday. Wednesday, update, this is from yesterday. Florida, daily number, 569 new cases in what was effectively a 2-day update. New Jersey, weekday or weekly, won't know for sure until today. 2,278 new cases and 5 new deaths since Friday's posting 5 days ago, as of yesterday. New York, daily, 822 new cases as of yesterday. I don't know if we're going to get anything from the New York dashboard when we go look at that in a few minutes. It hasn't updated. I've been hitting refresh. We'll hit refresh again in a couple of minutes. Puerto Rico, daily number, 154 new cases. Arizona, weekly COVID number, 1,262 new cases. Newly reported deaths won't be known until the CDC data tracker updates on Friday. Maryland had 1,452 new cases and 9 new deaths. Nevada, 215 new cases. North Dakota, 258 new cases and 4 deaths reported by the CDC data tracker last Friday. Oregon, weekly number, new positive tests, 202 of them, and 6 new deaths. South Dakota, 311 new cases. Tennessee, 245 new state-reported hospitalizations. Like Arizona, new deaths will not be known until Friday when CDC updates. Washington State, 415 emergency departments and 11 new deaths. And we do have more from Washington State in just a second. Let's see here. Did we get anything from New York State today? I hope this is fine. Nope. We'll try for the hospitalizations. That's the same number from yesterday. No, nothing from New York State. All right, continuing with Washington State, where we do have COVID-19 percent of emergency department visits. That actually went up by 17%. See, things aren't behaving the same in all around the country. Some local states, maybe local cities or regions, are behaving differently. On a national level, yeah, COVID's not really going up right now, but there are individualized areas that are doing their own thing. Percentage of the hospital admissions, that's up by 14%. And take a look at this. Hospital admissions to influenza is 5%, 8% for emergency department visits. Influenza in the ICU is up to 63. COVID-19 up by 1, up to 12. That was a 5 increase for influenza. Taking a look at Colorado, we see almost everything is fine here. Just a slight increase in diagnosed emergency department visits for COVID. COVID hospital admission count is 44. Influenza is 340. RSV is 147. Emergency department visits, the highest one that we're seeing diagnosed percent is influenza at this time. Weekly positivity rates down slightly for everything. Down a good bit for influenza. COVID, 3.17%. Influenza, 21.61%. That's actually down by 3.24%. And RSV, 10.24%. That's just down by 0.5% at this time. All right, taking a look at what's going on in Ohio. Influenza is still very high statewide. Taking a look at the update for COVID at this time, we see COVID cases did actually come down a good amount. Last week's report was 5,422 cases. Today is 4,616. Hospitalizations are down. 191 last week's report, 171 today's report. ICU admissions went up by 2 from 5 to 7. Deaths, they were 46 and they have dropped to 29 in this week's update. Alrighty, folks, we will have another update tomorrow. We should get a whole bunch of data from CDC. We'll get the news of the day. We'll have Los Angeles if we can get to it tomorrow. Sometimes Fridays can be as crazy as Thursdays, and we'll have all the news of the day and, everything else. If you enjoyed this video, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. And, of course, leave your comments down below. And like I said, if you want me to show a certain area, whether it be in wastewater or any of the daily data that we show, maybe it's just hospital capacity or something else in which we show in the state format, let me know down below. I will try my best to see if I can't find anything. I will see everyone again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Thursday evening. Thanks for watching.